Hey everyone, this is Dr. Dune from Greeley Dental Care. We're going to be talking about the maintenance and the post-care for your surgery. This is going to be really important. So you've just had the surgery done, and a lot of people after the surgery, two things can happen. You're going to be sore or you're not sore at all. And so what I want to prepare you for is on day 3, 4, and 5, it's going to get more sore. Okay, so just anticipate that if you're in your first day or two and it's not bad at all, that it will get worse. When I did my uncle's case, he traveled in and traveled out, and he was like, oh, everything is fine. And then he called me 3 days later and he was worried. And he was worried because it started feeling worse. So I want to make sure everyone who's watching this video, if it starts getting worse around day 3, 4, and 5, that's just your body's natural reaction, right? So the body is mounting its immune response, and that's bringing all the inflammatory cells to that area, and it's just a natural response. So if we're taking wisdom teeth out on a kiddo or a young adult, they're gonna feel pain around 3, 4, and 5 days. It's the same thing with this type of surgery. So just know that that's normal. Part 2 is your antibiotics that you have been prescribed are the most important thing that you can take in this entire process. Absolutely critical. I cannot stress that one enough. I need you to make sure you're taking your antibiotics, and if there's any questions at all, you should have my personal cell phone number or the office number. If you call the office number, there's a prompt even after hours on the weekend to reach me personally, because maintenance and care for you post-surgically is so critical. I want you to text me, I want you to call me, whatever questions you have, however you like to communicate, I want you to reach out to me. Then we're going to have a steroid, right? And there could be various steroids. So we have a steroid for you to take that's going to help with swelling. Sometimes you may not be prescribed a steroid because you have other medical issues where there's going to be a cross reaction with it. So if you haven't been prescribed a steroid, it's not the end of the world. You're going to have a pain medication, and you're also going to have ibuprofen. So the pain medication is going to help on the central nervous system, and your ibuprofen is going to help on the peripheral nervous system. So imagine there's 2 pathways of pain that come in, and we can block it at 2 different points. So from that perspective, a lot of people like to take one medication, then 3 hours later the next one, then 3 hours later the next one. So you kind of stagger out the medication throughout the day, and you get really good pain relief that way. So that's going to be the vast majority of the medications you're going to take. Now after that, there's going to be a mouth rinse we're going to give you. The mouth rinse is most likely going to be Closis or Stella Life. So it's just a rinse. This is critical because it's going to clean the sites. So it has hypochlorous acid in it, which means it's going to clean out the sites really well from a surgical perspective, and it's going to decrease the chance of you having a bacterial infection on your surgery, which is critical in the very beginning. So when you rinse, you want to make sure that when you put the mouth rinse in, you don't swish aggressively, because I don't want you tearing your sutures. I want you to just turn your head back and forth and lightly move the solution back and forth and let it come out. After you see me at your 1 or 2 week appointment, then I'll give you a little syringe to clean these areas out a little bit more thoroughly. But in the beginning, just make sure you swish after every meal and you get as much food out as you can. But I don't want you tearing your stitches. So there's kind of this fine line you have to walk with cleaning, but not over cleaning. You'd be surprised, but I see more people over clean them and open a stitch than I see people under clean them. So from the perspective of rinsing it, rinse it thoroughly. Even if you're rinsing at the sink, and 5 minutes rinsing is a long time, even if you're rinsing for 5 minutes but gently, that's going to be a better service for you than rinsing aggressively for 15 seconds. So make sure you just take your time for the first 2 weeks when you rinse, so we can prevent an infection and we can prevent an incision line opening. After the 2 week marker, you're going to be in really good shape. This is the most important 2 weeks because the tissue is going to close and the body is going to seal everything closed. After that 2 weeks, if we get you successful, you have a very high chance at having a success on the surgery, like a 97% success rate if we can get that first 2 weeks done. So a few things that are going to set you back are any type of smoking, any type of oral tobacco products, or certain medications we might talk about in your consultation. So for whatever reason, if you feel like there's an issue in the first 2 weeks, I need you to reach out to me. If you feel like you're going to bother me, you're never bothering me. I'm here to guide you from A to Z, and I get everyone to the finish line. And when we communicate really well, that's when I get really good results. So I just want you to know, here's my invitation to you. Reach out to me at any time because I want to make sure I get you taken care of in the way where you can do the least amount of dentistry possible. So reach out to me. My name is Dr. Dune, of course, at Greeley Dental Care, and I'm here to help.